Neck pain is one of the most common reasons for seeking physiotherapy. It affects both sedentary people and athletes, and is closely related to sustained postures, repetitive movements, and muscle imbalances. The clinical challenge lies in the fact that many times the origin is not just articular or postural, but neuromuscular. Muscles that should be stabilizing are inhibited, while others compensate by overworking. Knowing how to identify these patterns is key to designing an effective treatment, and here you will learn how to do it. Do you want to learn how to use electromyography in the assessment of neck pain? Get all the information about endurance and how to apply it through the link in the video description. In this post, you will find a step-by-step protocol to assess the synergy between the SCM and the upper trapezius, two of the muscles most involved in neck pain, using clinical tests and surface electromyography. Scientific literature has found a direct relationship between neck pain and neuromuscular alterations in the SCM and upper trapezius. In the SCM, an activation deficit limits rotation, inclination, and cervical flexion. In the upper trapezius, which is one of the muscles most prone to overactivation, this leads to overload and excessive tension in the cervical region. Furthermore, there is evidence that patients with neck pain often show abnormal activation levels even at rest, which may explain fatigue and the constant feeling of stiffness. That is why evaluating the synergy between these muscles, the SCM and the upper trapezius, is essential to identify the cause or consequences of the pain, rather than just treating the symptoms. Copy our 4-test protocol to assess the SCM and upper trapezius. The first test is a supine neck flexion, and the goal is to detect whether the upper trapezius is overcompensating for the SCM during cervical flexion. The patient, lying supine, performs neck flexion against gentle resistance. Look at the results. The left SCM activates more than the left and right upper trapezius. This is good synergy. The left upper trapezius activates much more than the right upper trapezius. We have unilateral hyperactivity. The left trapezius needs twice the recruitment of the contralateral side to perform a movement where it is not the main actor. This indicates trapezius compensation, generating greater tension toward the cervical region. The second test is a shoulder flexion. The goal is to assess the involvement of the upper trapezius in a shoulder flexion movement. The patient, either seated or standing, performs shoulder flexion to the maximum range. Look at this example. The right upper trapezius is hyperactive. Again, it requires twice the activation as the contralateral side. This pattern, again, generates chronic cervical tension and overload in the upper region of the scapula. The third test is an alternating cervical rotation from left to right. The goal is to assess whether there is a deficit in activation of the SCM during left and right cervical rotation. The patient, while seated, alternately rotates their head from one side to the other. Look at the graph. The left SCM has less activation than the right. The consequence is a limitation in cervical rotation to the right and the appearance of muscular compensations in the trapezius or the scalenes. The fourth test is a postural control test in a seated position. The goal is to check the ability of the SCM and upper trapezius to relax at rest. The way to perform this test is very simple. The patient sits without moving in a neutral position. Our reference will be that a relaxed muscle should be below 30 microvolts. Look at the results. The left SCM and the right upper trapezius are active at rest at more than 30 microvolts. This indicates a pattern of constant hyperactivity, typical in patients with chronic neck pain. Therefore, neck pain is not always explained by joint stiffness or poor posture. In many cases, it is due to alterations in the synergy between the SCM and the upper trapezius. With this protocol, you can detect muscle hyperactivity at rest that explains the muscle fatigue the patient feels. Identify if the upper trapezius compensates for the SCM during dynamic tasks, and use electromyography as a biofeedback tool to retrain muscle activation. This way, you'll be able to design a more precise treatment based on objective data and aligned with the patient's real needs. See you in the next post.